Hi, good evening. This is Professor Schleich here. I'm going to be doing a lecture over the following chapters in our ICD-10-CM coding manual. We'll be looking at Chapter 5, Mental Behavior and Neurodevelopment Disorders, which the codes are F01 to F099. That. And we'll be looking at Chapter 6, Diseases of the Nervous System, G00 to G99. We'll review Chapter 7, Diseases of the Eye and Adnexa, H00 to H59. And Chapter 8, Diseases of the Ear and Mastoid Process, which cover the codes H60 to H95. So let's get started. If you have a coding manual, please open that up to Chapter 5, which is the Mental, Behavioral, and Neurodevelopment Disorders, F1 to 99. You'll see the chapter-specific guidelines with coding examples right at the very beginning of the tabular. The first one, A, pain disorders related to psychological factors. So I'm going to review a little bit of the PowerPoint with these few chapters, and you'll see that I may peruse through those. If you have availability to those PowerPoints within your classroom, you need to pull those back up and take some time to review those. So what we're looking at are the official guidelines for these chapters and how they apply to the codes that you'll be working on this week. So let's get started. So I always suggest to my class or my students that they actually open up the coding manual before they ever start into their textbook or whatever it is they're using, and just take a look at the codes and the diagnoses that you will be reviewing. This week we're looking at Chapter 5, which is Mental and Behavioral Disorders. So take a look at the different blocks or the categories that you're looking at. Mental disorders due to known psychological conditions, mental and behavioral disorders due to psychoactive substance abuse, schizophrenia, delusional, other mood psychosis. We'll look at mood disorders, anxiety, behavioral syndromes, disorders of adult personality and behavior. Within this chapter, there are intellectual disabilities, pervasive and specific development disorders, behavioral and emotional disorders, and an unspecified mental disorder. So also within this chapter, we have, if you are working for a psychiatrist or a psychologist, they also have their own coding manual. It's the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, and they will utilize the same codes from Chapter 5. Names of the conditions with the ICD codes do not match the DSM-5 name, which is kind of crazy, but you can take a look at that at the following website, www.sps or psychiatric.org. So what the DSM-5, it provides descriptions of diagnostic categories that allows clinicians to diagnose and communicate about, study, and treat those patients. Okay, so let's take a look at what we are going to be doing this week. Instructional notes in Chapter 5, read all very carefully. As we've started before, we've reviewed 4 of the chapters, Chapter 1, 2, 3, 4, and so you know that there are chapter-specific guidelines that are related to all of the diagnosis. So chapter-specific guidelines, the first one is pain disorders related to psychological factors, and they talk about that as F4541. So if you have your coding manual, just take a look at that code, and then the F4542 also pertains to that. Psychoactive substance abuse, there's codes for that is based on provider documentation. As with all chapters, your physician must document that diagnosis before it can be used, and the chart must show substantial evidence that diagnosis was verified then. So codes organized into related sections. Physician's documentation must be followed carefully, especially in mental health. You don't want to be giving someone a diagnosis that they don't have. In my opinion, there's no rule out in mental health disorders. You either have it or you don't, and I'm very careful not to put a diagnosis on a patient's chart if it's not been verified. Codes include related conditions and manifestations in this case, and as you make your way through, you'll see that there's multiple coding underneath a lot of those categories, and they'll tell you to first code the associated physical disorders. So in this case, the F54 is physiological behavior factors associated with disorders or disease. So you should code first the associated physical conditions such as asthma, dermatitis, gastric ulcer, mucosal colitis, and ulcerative colitis or urticaria. You'll read through. There are more multiple notes to that, and there's 31 slides here, so we'll read through some of these. Inclusion notes say that ecstasy or PCP are included in hallucinogenic related disorders, as these are hallucinogenic drugs. Excuse me. Inclusion note that identifies what conditions are included with F44. So open up your coding manual and hit that F44 dissociative and conversion disorders then. We all know and should know by now what inclusion and exclusion notes mean. And as I've mentioned before, if you are unsure of that, you should return to the very beginning of your coding manual, and where they talk about the conventions and the format, and they will tell you exactly how you are to utilize the excludes 1 and excludes 2. So I'm actually looking at the Section 1 convention guide, general coding guidelines and chapter-specific guidelines, and that is A, conventions for ICD-10-CM, and you'll see number 12 talks about 11 talks about inclusion terms, 12 talks about exclusion notes 1 and 2. So please go back and review those if you are unfamiliar or have forgotten or just getting used to reviewing through the coding manual, as they will pertain to every chapter. As we hit the last few chapters of the coding manual, all the conventions and formats are basically applied the same way. So we have alcohol-related disorders in this chapter, also substance use disorders, and you'll see a variety or a list of those. All categories include codes for drug abuse, drug dependence, and drug use, unspecified, so you can be more specific. The documentation in the chart allows you. You can pick up a nicotine dependence. This is psychoactive substance abuse. Dependence also can be applied and coded out if it is mentioned in the chart. Other mental, behavioral, and neurodevelopment disorders start with F20 codes to F79. Schizophrenia, mood, anxiety, intellectual disabilities, and then we get into the procedures for this chapter that are related to mental health. And again, you have an entirely different class for that. Usually this is just covering the diagnosis, but this is a little refresher on the PowerPoint, so that if you do have to code out some of those procedures, we talk about the root type, the qualifiers in each one of those sections. All right, let's keep moving forward. Before we get into this next chapter, I am actually going to back up just a little bit. And I'm going to have you just look at your coding manual for Chapter 5. And I want you to just look at the other chapter-specific coding guidelines then. So we look at A. It says pain disorders related to the psychological factors. Assign F4541 for pain that is exclusively related to psychological disorders, as indicated by the exclude 1 note under category G89. And let's take a look at G89. The code from category G89 should not be assigned to the code F4541. So when you look at the G89, it tells you just exactly what's stated in that chapter-specific guideline. So G89, pain and not classified elsewhere, could also relate to psychological factors associated with the pain. So we have F4542. There's an excludes 1, excludes 2, and then, as I've taught you in the past with our last chapter, that is the beginning of the section, other disorders of the nervous system, which is above the code G89. You're looking at codes G89 to G99. Then what you need to do is to go back to the beginning of the chapter. That is your section. Go back to the beginning of that chapter. And, well, excuse me, that was a note that said go back to 4541, so I apologize for that. So we're going to go back and we're going to look at our F4541. Sorry, see, it's been a long day, but I apologize for that. Been coding all day long, and then I get to code again tonight. So B4145 tells us B4541 states pain. The category is B45-4, and you'll see to the left of the red block that says fifth digit is needed, so you cannot use the F45-4. Pain disorders related to psychological factors exclude pain, but we are going to need a fifth digit, so we'll need F4541, pain disorder exclusively related to psychological factors. That is the code we're looking at, okay? So we want to go back to the beginning of that category. That category starts above the code F40, anxiety, dissociative, stress-related, somatoform, and other non-psychotic mental disorders. Okay, so those are the codes F40 to F48. Then we need to go back to the beginning of that chapter 5. And that begins right above the code F01. So above that is your chapter guidelines. You'll see we have an includes note, disorders of psychological development, excludes 2 note, symptom signs, abnormal clinical laboratory findings not elsewhere classified, R00 to R99. Then it says this chapter contains the following blocks, and it gives you what will be included in that. Okay, so then we'll go back to the beginning of the chapter where the official guidelines are, and you'll see chapter-specific guidelines with coding examples. And what we're talking about is number A, and you'll see in the lavender shaded box, it says a perceived abdominal pain determined to be persistent somatoform pain disorder, the F4541. Explanation, this pain was diagnosed as being exclusively psychological, therefore no code from G. Category G89 is added then. So it gives you a little bit of information about that. As you're coding through this chapter, you'll see that there are guidelines B, mental and behavioral disorders due to psychoactive substance abuse in remission. Number 1. Number 2, psychoactive substance abuse, use, abuse, and dependence. 3, psychoactive substance abuse unspecified. And C is a factitious disorder. So again, before you ever start with these chapters, I suggest that you work your way through those little examples and read through the guidelines. They're very beneficial in that part. All right, so our next chapter we're going to look at in the coding manual will be chapter 6, which is the diseases of the nervous system. You'll see that the codes are G00 to G99. Open up your coding manual to that portion of that. So again, they talk about the G89. Pain not elsewhere classified includes a note. Could also related psychological factors afflicted with pain, and that is what we just went through. Overview for diseases of the nervous system then. Here's some of the diseases that will be included: inflammatory disease, degenerative, demyelinating diseases of the central nervous system, nerve, cerebral palsy, other disorders of that nervous system then. So it's a good idea to review the anatomy of the nervous system so that you are familiar with that before you start to code in this section. Your central nervous system includes the brain, spinal cord, as well as the peripheral nervous system then. We have excludes notes throughout chapter 6. They start at the beginning of the chapter. States conditions from other chapters can be used in addition to the codes for the diseases of that nervous system. So throughout the chapter, there are instructional notes to use additional code to identify an organism, code first an underlying disease, use additional code for adverse effect, and code also associated conditions. So again, that is what you're looking for when you're coding. The coding book guides you very well. Back in the day when I first started to code, we didn't have all these notes. We were expected to know the anatomy, the physiology, and the disease process of a certain diagnosis in order to code it out appropriately. So again, they're talking about the G89. There are codes for category G81. So if you have your code book open, please turn to that, and you'll see that it talks about hemiplegia and hemiparalysis. Then talk a lot about the pain. We have meningitis under this chapter, organic sleep disorders. Alzheimer's will fall underneath this, degenerative disorders, encounters for pain management, generalized pain. They talk a lot about pain. Obviously, the nervous system is a huge control center for that. So if the encounter is for pain control or pain management, you're going to go back to that G89. It's sequenced first, and then the code for the specific site of pain, actually. Okay? Codes for postoperative or post-thoracotomy pain or the G89. I use those a lot. I work on 2 surgery floors, my surgical and renal floor, and so I do utilize these 2 codes quite frequently. If postoperative pain is not described as acute or chronic, you can use the G89.18 as the default code for the acute form then. Post-op pain may be listed, principal or first listed when the reason for the admission or outpatient business document is postoperative pain control. Postoperative pain can be reported as a secondary diagnosis when a patient has outpatient surgery and develops an unusual amount of postoperative of pain then. Routine or expected postoperative pain should not be coded immediately after surgery. And in my case, if they're giving an overabundance of fentanyl or any kind of a pain control medication in excess, then I will be coding out that postoperative pain. We have cerebral palsy to follow to this, hemiplegia, hemiparalysis again, epilepsy and recurrent seizures fall into this category. The migraines also and other types of headaches, so it's very interesting, especially I know a lot of people have headaches and migraines, so it's kind of interesting to see how they're coded out. Post-procedural complications, again, these are just a few of those that are listed and will be under category G97. Documentation of complications of care must be clearly indicated with any diagnosis that you're going to be coding. And then we hit the procedures. That's an entirely different section and class that you will have procedures for related nervous system. So I'll breeze through these just a little bit, and you should be familiar with those if you've actually studied procedures related to the nervous system. All right, very good. And that was chapter 6. Then we're going to move into chapter 7. So open up your coding manual. And again, remember, you will be finding your diagnosis in the index. You'll start with the index, and then you'll make your way into the tabular and until you've totally coded out your diagnostic statement. Chapter 7 is disease of the eye and Adnexa. I find these chapters are fairly easy to review. Pretty simple diagnosis, nothing too complicated is going to be popping out of this with these few chapters. So the eye and Adnexa, let's get into our next PowerPoint here. I'm going to move on, okay. So chapter 7 includes disease of the eyelid, conjunctiva, sclera, lens, glaucoma, the globe, the body of that. And if you go into chapter 7 in your coding manual, you'll see these different diagnoses are addressed. So again, as I mentioned, there's just one page actually of coding guidelines for the eye and Adnexa for the codes H00 to H59. So we have glaucoma, and they talk about assigning glaucoma. Number 1, the guidelines that cover that. 2, bilateral glaucoma with the same type and stage. 3, bilateral glaucoma with the different types and stages also then. So basically your guidelines are covering glaucoma, and then B covers the blindness. And if you are struggling with finding some of the terms, or hey, how do I tear apart this diagnosis? Pigmentary glaucoma, bilateral severe stage. Obviously you're going to hit your main term index, which is glaucoma, then pigmentary, and then do bilateral and severe stage. So again, you kind of work backwards when you're working through the coding manual. Okay. Instructional note at the start of the chapter to use an external cause code following the code for an eye condition. So if you can identify that, you need to pick that up also. A series of excludes 2 conditions are listed that are applicable to all conditions coded in chapter 7. And we just reviewed the guidelines for assigning glaucoma code. So that is basically what your coding guidelines will cover. Disorders of the eyelid, the lacrimal system, and the orbits. Again, also, it's nice to have a photo of the eye and Adnexa so that you have an idea of what you're actually working with on that. Disorders of the sclera, inflammatory conditions. All eye conditions can be specified as right, left bilateral, or unspecified laterality. Disorders of the lens, age-related cataracts, juvenile cataracts, retinal detachment and breaks. We'll talk about that. Glaucoma, again, is heavily discussed in this chapter. And again, to review through these, there are 30-some PowerPoints here to review. Malignant means it is severe and progressive over time, usually a complication of eye surgery, requiring additional surgical treatment. Disorders of the eye following cataract surgery, so you will be able to code out the intraoperative post-procedural complications and disorders of the eye that may follow some type of surgery. Other intraoperative complications, they may have hemorrhage, hematoma, accidental puncture, or laceration of the eye during a procedure, post-procedural hemorrhage of the eye, adnexa, again, inflammation scars. Then we hit the procedures for the eye and adnexa. They start with 2 characters, 0 and 8, followed by 5 characters for procedures performed on the eye. And again, I don't cover procedures real heavily in this class as we're working on diagnosis. So again, if you have the opportunity to read through these PowerPoints for that, it will be very beneficial when you're coding out the procedures also. All right, let's move into our last PowerPoint. And this one will cover disease of the ear and mastoid. So that is Chapter 8. Your coding manual knows a very small section of the coding manual. And guess what? The fun thing is that you can get a break because there are actually no guidelines for ear and mastoid process for codes age 60 to age 95. They're reserved for future guidelines. So again, fairly easy chapter to review. This chapter includes disease of the external ear, middle ear, other disorders. They'll talk about intraoperative post-procedural complication disorders of the ear mastoid process that aren't classified anywhere else. As they stated, no chapter-specific guidelines for Chapter 8 have been published. So make sure that you're reading the instructional notes. A series of excludes 2 are listed and they're applicable to all codes. Other instructional notes remind the coder to code first associated conditions, to use an additional code as directed. Instructor notes appear with certain categories, to use an additional code to identify exposure to tobacco, smoke, tobacco dependence, tobacco use. Then this chapter also contains specific codes for infections, inflammation, lesions, obstructions, hearing loss, other conditions within the ear mastoid process. And again, if you have a photo of the ear, it's great to kind of give you a visual. I'm a visual person, so I like to see things before I actually get started in. You may code out, if you're working in a clinic, not necessarily a hospital, diagnosis of otitis externa is infection, and that is coded frequently, obviously, in clinics, and obviously we're working in a hospital setting. Acute form is characterized by pain, fever, regional cellulite, partial hearing loss. Then we have the chronic form. You'll find that they have laterality, right, left bilateral, and unspecified. We have subcategories H62.4, H62.8, requiring the reporting of the underlying disease that has caused the external ear condition. So again, you're going to have to read through the chart and make sure that your physician is documenting that. A code first underlying condition note includes the possible underlying conditions of ear, if I can pronounce this right, earwise, sipilius, or impetigo. We have the code H65 to H75. Use additional code for both of those. Otitis media, again, if you have children, you probably have at least 1 or 2 incidents of otitis media. If you have tubes, acute and chronic infections of the eustachian tube in the ear, obstruction of that, salpingitis is the inflammation of a tubular site. So if you don't know some of these terminology, you will learn some new things. Mastoiditis and related conditions are category H70 if you're following along in your coding manual. Otosclerosis is H80, growth of the spongy bone in the inner ear where it causes obstruction. Meniere's disease, you may have heard that, causes severe dizziness, vertigo, ringing in the ears, hearing loss, of feeling of fullness or congestion in the ears. So again, we are learning a little bit about the ear. Benign proximal positional vertigo, I have that. Hearing loss, conducive hearing loss. And then we go back into, which I love this with the new PowerPoints and the new coding, that they have intraoperative and post-procedural complications. So again, they do mention some of the complications that may occur: accidental puncture, laceration, hemorrhage, stenosis of an external ear. And again, they start with 2 characters, 0 and 9, followed by 5 characters for the procedures performed on the ear. So we are talking about procedures here and not about diagnosis. These are your body parts. Here's your approach. Here's your character 6, character 7, and then they talk about the different procedures that will be located in the tables within the coding manual. So again, fairly easy chapters to hit for chapters 5, 6, 7, and 8. And as always, I suggest that everyone, whatever textbook or classroom material you're using, please get in there and do all the questions you possibly can with the answers. It will guide you. If you cannot figure out how they come across that answer, I mean, at least you have the answer. You can go into your index and make your way to that code and then follow it back through the system to figure out why they arrived at that correct code. And that is the most efficient process, and that's how I learned. So many years ago, the coding has not changed in all these years, but that is how we learn, is we just practice, practice, practice. So again, thank you for joining me, and I wish you the best of luck with these chapters. Thank you, and have a great evening.